Welcome back. We're going to continue our airway discussion with the use of CPAP. CPAP is an acronym that stands for Continuous Positive Airway Pressure. It's a tool used in EMS as a non-invasive ventilatory support tool for patients experiencing respiratory distress. Many patients use CPAP at home for conditions such as sleep apnea, but it's more widely becoming used in the pre-hospital setting, specifically at the EMT level, for patients with congestive heart failure, asthma, or other significant respiratory events. CPAP works by increasing the pressure in the lungs through a mechanism called PEEP, or Positive End Expiratory Pressure. This helps open collapsed alveolar tissue. It helps push more oxygen across the alveolar membrane to facilitate gas exchange, and it forces interstitial fluid back into pulmonary circulation, helping address some of the symptoms caused by things like post-submersion respiratory distress events or congestive heart failure. Therapy is delivered through a face mask, as you can see here on the screen, with the face mask held in place by a strapping system that's attached to the patients. There are several indications and many more contraindications that we'll discuss, but it's important to note the importance of not using CPAP in patients with low blood pressure. Using it in a patient with low blood pressure can result in significant cardiac compromise, as this increase that's caused in the thoracic cavity by the use of CPAP can further reduce cardiac output and have significant impacts on the patient's blood pressure. As far as indications for the use of CPAP, patients should be able to follow commands and should be alert to be a candidate for CPAP. Patients who are displaying obvious signs of moderate to severe respiratory distress, patients that have respiratory distress secondary to a submersion incident, so near drowning, a patient who is breathing rapidly with signs of respiratory compromise, and pulse oximetry readings that are less than 90% are all indications for the use of CPAP. The list of contraindications are long, but as stated earlier, are very important to keep in mind. Patients who are in respiratory arrest, CPAP is contraindicated. The patient has to be able to breathe on their own to ensure the effectiveness of CPAP, and it will not artificially ventilate a patient who is not able to ventilate on their own. So similarly, a patient who is hypoventilating would not be a candidate for CPAP. Rather, you should assist ventilations with a bag valve mask. A patient who is unresponsive, cannot speak, or unable to follow verbal commands should also not be placed on CPAP. A patient who cannot protect his or her own airway, and a patient who is hypotensive should not be placed on CPAP. Other contraindications, any sign or symptom of pneumothorax or collapsed lung or other chest trauma, a patient who has a tracheostomy, active gastrointestinal bleeding or vomiting, a patient who's experienced facial trauma or in cardiogenic shock, and then a patient who cannot sit upright or cannot tolerate the mask. We should not use CPAP. The resistance that's created, or the PEEP, positive end expiratory pressure, helps push the smaller airways open. In some masks, the PEEP is adjustable, as you can see here at the white knob at the distal end of the device. If the PEEP is adjustable, you're going to want to start at the lowest setting of PEEP and slowly adjust your way up until you achieve the desired results. Most cases, this will be between 7 and 10 centimeters of water. Some complications that may arise from CPAP. Oftentimes, patients who are experiencing respiratory distress can find the CPAP claustrophobic. This can increase anxiety and further deteriorate the respiratory status of the patient. You should try and coach the patient through any anxiety that they are experiencing. As the respiratory distress decreases, if this helps improve their status, their respiratory status, the patients will often calm down, find a sense of relief, and embrace the treatment. Under no circumstances should you hold the mask to the face of the patient if they can't tolerate the mask. You'll want to reassess frequently the patient's blood pressure and lung sounds. We're looking for any drop in cardiac output or any indication of a risk of barotrauma or pneumothorax. If the patient shows signs of deterioration, remove the CPAP immediately and begin ventilation with a bag valve mask.